Well, here we are back with Dr. Adami. Dr. Adami, orthodontics. There's a lots of different ortho type of stuff out there. Orthodontics ways of doing it. There's the old time, metal braces, looking ugly like hell. The type of things we used to laugh at the girls at, and they laughed at us when we had them. Blah blah blah. There's all kinds of other stuff. Go and tell us about the different type of treatments and what they're good for or not good for, just in case.
Sure. Well, I do two types of orthodontic movement of teeth. The first type I do looks a bit like the braces or the concept is much the same as the braces you had when you were a youngster. But the braces today are completely clear. We use a tooth-colored wire, and they're barely visible. It's a concept called 6-month smiles, where within 6 to 8 months, we can take most people's front teeth and get them in the ideal position. It's not full orthodontics the way you would have if you were 12 years old, because we're not trying to redo the entire bite and change the position of the back teeth all that much. But we're just it's basically cosmetic orthodontics. And it works very well. We can complete most cases within 6 months. I often tell my patients that by the time you come back for your next cleaning, how would you like to have straight teeth? And many people are intrigued by that, and I've done many cases and with fantastic results. There still is a segment of us, though, that just refuse to wear any kind of a brace on the teeth no matter what. For those cases, we do something called Invisalign. Invisalign is basically a computer-generated, it's a plastic aligner that looks almost like a thin whitening tray. And you wear a series of those. Each one is a little bit different than the one before it. So you wear each tray for about 2 weeks' time, and then you move on to the next tray. And then 2 weeks later, the next tray. So your teeth are gradually walked into position. The good thing about Invisalign is that if you have a function, you have a date or a wedding or what have you, you can take it out and then you put it back in when you get home, so no one knows that you're doing orthodontics on yourself. It's a fantastic procedure. It's got some limitations, but not many. And between Invisalign and the 6-month smiles, I can pretty much get anybody's mouth or anybody's teeth rather, looking straight and perfect within 6 to 8 months.
Well, great. Let me ask you a question. So, the 6 months smile. Number one, is that for adults also, or is it specifically for adults?
It's only for adults. Correct. It's only for adults.
Okay.
Right.
Because I heard that the Invisalign was first invented mainly for the adults, and the only reason it wasn't done too much for the young kids/teenagers is because they would take them out too often, and thus the treatment got too much prolonged. But apparently that doesn't seem to be too much of a problem anymore now, and many teenagers are doing them, right?
Right. That's correct. I do a lot of teenagers. Occasionally we'll run into what we call a compliance problem where the teenager just doesn't wear them often enough or sometimes loses them. And it can be a bit frustrating. In those cases, we recommend that we do 6-month smiles where the braces are on the teeth for the entire duration. It doesn't take much in terms of compliance on the patient's part, and the teeth seem to magically move into position in a very short period of time. But that's just for adults.
Got it. Now, you said that, that seems to be a big advantage with Invisalign of being able to take your invisible tray out while or after eating for brushing. Is that what it is?
Yes. The only time it's supposed to be out of your mouth is when you're eating and when you're brushing and flossing. It is near impossible to eat with them in, and of course you cannot brush or floss properly with them in. So they're in your mouth 20 to 22 hours per day, and you of course sleep with them as well.
What about if you're somebody like me who nibbles away all day long? Then you never have him in, or what?
Well, the good thing is the average patient loses about 7 pounds doing Invisalign throughout the course of the treatment. Yeah, because you just don't snack as much because you just don't want to take them out, so you walk right past that donut or that cookie, and then you'll see a few pounds come off as well. That's sort of a nice side benefit.
Don't tell my wife about it. She's going to make me get Invisalign right away. So now, on the other hand, on one hand, they're invisible, but you also mentioned and said that, well, if you have that date or that job interview, then you might want to take them out. So do you see them or you don't see them?
You see them if you look for them. If they are somewhat shiny, they are not completely invisible, but they can sometimes affect your speech a little bit. So people sometimes get a bit self-conscious having them in while they're trying to speak to, either a job interview or giving a lecture or a photo shoot. So oftentimes when you're very close to someone, you'll want to take them out because they're not completely invisible.
Okay. And especially maybe at the beginning while you're getting used to it to get the speech or so going. But probably down the road you get a little better with that, get more accustomed to it, right? Yeah,
yes. The speech issue almost always takes care of itself within the first few weeks. Absolutely.
Okay.
You acclimate very quickly to them.
Okay, great. And so the Invisalign is a 2-year treatment. I think I'm not so sure. I got that.
No. Most cases are completed within about a year. I think the average treatment time is 13 months. So 2 years would be a very long case. And I haven't done many cases that go past a year and a half. 2 years being the upper limit.
Okay. Well, wonderful. Is the 6 months one, because it goes so fast and so beautiful, is that a lot more expensive than the, let's say, Invisalign or the normal braces?
Actually, it's a bit less expensive because the technology that goes into it is not quite as sophisticated as the computer-generated Invisalign technique. So it's roughly $1,000 less for the 6-month Smiles option than it is for the Invisalign option. I personally like that option currently because it does give me more control over very minor movements. The Invisalign, it's difficult to get fussy at the end of the treatment with Invisalign. With the 6-month Smiles, we can make very minor movements in a very short period of time.
Well, wonderful. So there seems to be coming new options out all the time, and
absolutely, it's an exciting field, no question about it.
Yeah, good. Thanks a lot. That was Dr. Adami on orthodontics.